All right, everybody, welcome back to Page in America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. Dr. Rob, you're coming to us from a new location. Where are you at?
Well, I'm going to say good morning from tomorrow. I'm down under. I'm in New Zealand right now, taking a bit of a spell here. Spent some time here. Gosh, over a decade ago with the whole family working in a healthcare system with universal healthcare. Boy, that's an amazing thing. We can talk about that at some point. But yeah, so good morning from tomorrow. The future does not look that much better than the present. I will tell you what, the news headlines here are just as bad as what you're getting right now.
I bet.
Oof.
I bet. Are people, have you run into anyone talking about it? Talking about Greenland?
Yeah. When we got our rental car, she's like, from the US. And we always say, oh, we're really sorry. She's like, oh, no, we're sorry for you guys. Oh, we feel bad for you guys having to deal with this guy. I'm like, oh, I know. And here they're a little more insulated, right? Because they're on the other side of the world and across a big ocean. But I tell you what, if they were, 1,000 miles further to the east, they may be in a bit of trouble, right?
I think the smaller countries always are aware of the fact that there can be political catastrophe in the way that I think the United States is just kind of waking up to the fact that we could have a political catastrophe and that there'd be very real consequences for lots of us. Troubling. Anyway, that is, I'm glad you're down there having a good time. It's absolutely frozen over in Chicago, and we're going to just do some recording, and we're going to do the podcast, and we're going to get through it. So,
make sure your furnace is working.
Yeah, absolutely. All right, everybody, we have a big show for you today. Top of the show, we're going to cover Trump's great healthcare plan. That's kind of a plan, barely a plan. And we're going to get into the details or lack thereof of that. We're going to spend some time talking about the nexus of ICE and healthcare and what a scary place that is to be. Dr. Oz's recent comments on OBGYNs in Alabama, and then some RFK quotes about Donald Trump. And then on the back half of the show, stick around. We have an incredible guest in Dr. Erin Stevens, who is based in Minneapolis and is going to give us an eyes on the ground view as she sees it on what's happening with ICE and the healthcare system in the Twin Cities. So a great perspective to hear from, and so stick around for that. But we can jump right into the show now. So Rob, I think we got to start with Donald Trump's big reveal. He's had a lot of big reveals lately, but the president unveiled what he is referring to as the Great Healthcare Plan, another big braggadocious, almost Rococo name for his healthcare plan. So a couple of details to tee us up. Over a decade after Trump said he had a much better healthcare plan than Obamacare, and it would cover everybody and, quote, save so much money, he finally released his so-called Great Healthcare Plan. His plan has all the appearances of vaporware with a flashy website and nearly no details. Under his plan, he says the prices of many drugs will be slashed by 300, 400, and 500%, a mathematical impossibility. And he takes credit for lowering the cost of insulin, something that has happened under Biden. He says he will stop sending big insurance company billions in extra taxpayer-funded subsidy payments and instead send that money directly to eligible Americans to allow them, you guessed it, send it to insurance companies to buy health insurance. We don't like how much money goes to the insurance companies at Page in America, but I don't think he's going about it the right way. On the drug pricing, NPR reported last week that Trump struck deals with 16 drug companies, but they're still raising prices this year. So he's saying we're striking deals, prices are still going up. So those deals are somewhere in the future we can't see. Since September 16 major drug companies have inked deals with the Trump administration to lower prices. But in January, the time of year when pharmaceutical companies typically roll out price hikes, all 16 companies release higher list prices for some of their drugs. Drug companies, including the 16 that made deals, raised the prices of 872 brand name drugs in the first 2 weeks of 2026, according to a new analysis by 46 Brooklyn, a drug price research firm. In truth, most of it is a rehash of failed Republican ideas from the past decade and a half. Politico calls it a light on details proposal, which is the understatement of the century that has almost no chance of getting through Congress. The Guardian quotes one expert who says the plan includes absolutely no details. Rob, you have been looking over the paltry information about Donald Trump's healthcare plan. What's your reaction?
Well, earlier this week, you charged me specifically with becoming an expert on the great healthcare plan, right? I think it took me 5 minutes. Took me about 5 minutes. And then I did spend a lot more time on digging into some of the details.
Sure.
Am I remembering this right? The interview that Trump walked out on Leslie Stahl when she asked about the healthcare plan, he had a big binder, right? Didn't he have this big binder that he handed to her and walked off the set?
Binder.
Yeah. This is like a page. This is like the actual plan as released.
That binder didn't have anything. That didn't.
Nothing was in it. Right.
that was a prop binder. Yeah.
I mean, we all agree drug prices are too high. We all agree there should be deals. But I saw, there's reporting AbbVie, one pharmaceutical company, that inked a deal and it basically said, well, for Medicaid, state Medicaid programs and some people who want to purchase their drugs, with cash, we're going to lower some prices. And then other details of the deal have not been released and are still confidential. Like that to me is the crux of it all. These other pieces of these deals that we have no idea, right? These are not companies that just exist for the benefit of society. They have shareholders, right? They have CEOs. They have stock buyback programs. They make insane profits. And it looks right now, right, in the first few weeks of the new year, even despite this plan being rolled out, they're raising prices, right? They're doing the same thing. The price increases are in line with the price increases that have been happening the last 3 or 4 years in that same report from NPR. So that piece seems like complete bullshit, even though it's light on details. Whatever details there are don't seem to be actually helping people. And then we're back to this piece with health insurance and how do we help people afford health insurance in general, right? We do agree with the idea that we have to keep the subsidies for ACA insurance going at least another year or so, right? Just to help people from falling off a cliff. We have 4 million people estimated dropped insurance, 20-some million had insurance rates go up. This is back to the idea of giving. He even doesn't get into the details of what giving checks to people looks like. Is that
we don't
know.
Can I just a thought on that is like, if you there's not enough details, so we are definitionally speculating when we're talking about how much money or like what percentages or anything. So there's not an analysis to be done on what it would do to the insurance market. But if you take a bunch of people and take them out of Obamacare, and then you just send them money, and then you kind of hope or incentivize or even compel them to put money back into the insurance market, you could potentially destabilize the insurance market. And you could cause problems for people who have employer-based insurance, presumably, by screwing with the private market in such a sort of profound and at scale way.
Yeah. I mean, there's two ways you can release this money, right? You can give it to people to buy insurance, which then why the hell are we making people go through the step of getting a check and then buying insurance, right? And in that case, you're going to have probably healthier people kind of say, I'm just going to go for something shittier. And then the people who are left, the people who require prescription drugs and medical treatment, people with cancer, people with chronic diseases, all of their prices are going to go up. All of them. That's just a nature of the beast. Or you're going to be giving people money into these health savings accounts, which again, for people who make a lot of money, people with very good incomes are a great way to hide money from taxes and save it and use it to spend on healthcare. You can't buy insurance with HSAs. I mean, this is part of what Bill Cassidy, Senator Bill Cassidy in Louisiana did. And now Trump, I guess, has endorsed Bill Cassidy's opponent in a primary, right? So I don't know, is he going for the Cassidy piece of the plan and then chucking Cassidy to the side? That kind of tracks, right? That sees to make sense. So the lack of details about this, but even if you kind of game out any scenario under this quote plan to lower health insurance prices, none of them actually do it. So again, I think intentionally they're light on details. The website looks great, right? The website is very glossy, very pretty. The website for Trump RX, where they're supposedly bringing down drug prices, that's great. There's just nothing there that there isn't there. And you're right, the math doesn't work. 300, 400%, 500% decreases on drug prices. I don't think you're going to have Pfizer paying people to take, cholesterol meds. That doesn't seem to make sense, but
no,
that's how the math works.
Well, maybe could we linger on this Bill Cassidy news? So the New York Times is reporting, and we saw all over, I mean, anyone who's watching the news saw it, that Donald Trump, basically through an endorsement with some potential reporting that like maybe she didn't know it was coming or only knew it was coming for like a really brief period of time because like the campaign's not totally set up, and it might have just been kind of an on the fly decision. We weren't in the room, but it seems like maybe from Trump, like it seems like it maybe happened like kind of in real time. Maybe he's just feeling himself, and so he comes out and he endorses Congresswoman Julia Letlow to primary Bill Cassidy, who has thrown himself prostrate in front of Donald Trump over and over again, and more or less sold his doctor soul to MAGA and Trump to give the stamp of approval for RFK, who is now destroying American healthcare. And what does he get for all of his troubles? What does he get for throwing away his professional reputation, for shaming his grandchildren, for basically being like a healthcare Judas as his main contribution in this life to the world? What does he get? He gets a primary challenge endorsed by Donald Trump. I mean, as much to a better guy.
As much as I think you're describing the weave, that real-time decision, feeling it out. But as much as I think we have real concern about Trump's health and stability and mental acuity, he has an insane memory for retribution, right? And what did Senator Dr. Bill Cassidy do? He voted to convict in the impeachment, right? He was one of the 10 Republicans, or one of the handful. I forget the number. Don't quote me, but he did do that, right? So he thought, it seems,
and Trump never forgot.
No, never. So he gave a stamp of approval to Bobby Kennedy. He's been out there. I don't go on his X account much, but Senator Dr. Cassidy's X account previously, at least last week, the pinned tweet was a smiling picture of him in the Oval Office with President Trump, touting something bullshit.
Yeah.
And like the most predictable thing is that he would like completely stab him in the back, and at least it seems like maybe that happened. Who knows? I don't know if this person not even running. Is that what you're telling me? The person he endorsed?
She wasn't running and didn't really have a viable path. I can say this for sure. Like, I don't know what the nature of the behind the scenes conversations were. Maybe this has been in the works for weeks. We don't know, but it wasn't particularly public that she was like having like a big effort, she certainly wasn't viable for knocking off Kennedy until this happened. Cassidy. And now. Or I'm sorry, Kennedy, Cassidy.
Kennedy on your brain.
Kennedy on my brain. Think about the guy way too much. Takes up way too much space. Anyway, so the the big thing for me on this is like, one, the Republicans should learn the lesson that they are never going to get. He will knife you. He will put a shank in your back the minute it either helps him or if he just feels like it. And he'll literally do it to anybody, no matter how much you sell your soul to stay in his good graces. And it should be like a lesson. And I have no idea. Like, I don't know how many examples. I think we have 1,000 examples, high profile examples now. How many more do you need to like not spend the time, the short amount of time you have in this life sucking up to this guy?
Marjorie Taylor Brown, right? Or whatever the name was for her. I mean, just like they're everywhere. They're everywhere. Well, so I guess stay tuned. The great healthcare plan doesn't look so great. Doesn't look like a plan, really. And so I guess we'll see if we get another page added to the website at some point with any level of detail. But we'll be on it. We'll be on it. I'm an expert, Miles. I'm going to maintain that status as an expert every waking hour.
And we will also stay up to date on the Donald Trump's gambit to take a 99% compliant U.S. Senator and exchange him for a 100% compliant U.S. Senator from Louisiana.
Art of the deal, baby. Art of the deal.
Yeah, right. All right. Next up, we're going to talk about the nexus of ICE and healthcare. It's starting to be a scary place in Minneapolis. And so a lot of people are covering Minneapolis. There's a lot of different ways to look at Minneapolis. Here on this show, we're going to focus on interactions with medical providers and the healthcare system at large. So with 3,000 federal troops in Minnesota at this point for an immigration crackdown and another 1,500 on standby, I believe the 1,500 is potentially the Alaska Reserve, but we'll double check that, or and possible deployment from Alaska. Hospitals are reporting that ICE agents are menacing hospitals and showing up in hospitals and doing weird things in hospital systems. So healthcare workers in the Twin Cities report that U.S. Immigration and Customs Enforcement agents are entering hospitals with detained individuals, sometimes with warrants, but often without. And they're frequently present during patient care. So they're sitting there. And remember, these guys are just if you haven't seen the videos of when they're in the medical setting, it's not like they're switching it up. They're camoed out. They have their fatigues on in some cases. In some cases, they have weapons. I haven't seen anyone with weapons out. I've seen weapons holstered, but in the hospital setting, weapons holstered. And their presence is terrifying medical staff and raising concerns about patient safety, according to 5 nurses at Hennepin County Medical Center in Minneapolis, who asked to remain anonymous for fear of losing their jobs. A part of me wants to go on the news with my face and scream at the top of my lungs, an HCMC nurse said, but I'm very much right in the middle of this. It's gotten so bad. SIDRAP reports that Minnesota residents are delaying medical care for encountering ICE. And of course that's true. And that's to say, I think that's being citizens are, we know citizens are not even, some people are not even going to school right now, the schools. So people are delaying care. And then you couldn't even imagine in the immigrant community how, I got to imagine there's just sort of wide-reaching ramifications for access to care, or sort of that could be as severe as going to the ER, but even just my little stuff, maybe I'm not going to go get my my blood pressure medication script refilled because I'm not interested in getting out of the house or going out and about. Anyway, Rob, what's on your mind as we see ICE sort of start to impede the delivery of care in the Twin Cities?
I mean, every ER doc and ER nurse and staff and that will tell you, and this has been true my entire career, there is a bit of a natural friction between actual law enforcement, not ICE, but actual law enforcement and patient care. That just happens. It's part of the deal. People are brought in handcuffs, but requiring, you to do something to potentially save their lives. And the job of that officer is to keep the peace and to, potentially bring that person in. Who knows? Our job is to take care of those people. You have this entity of ICE that is shown themselves to be, just lawless and nabbing people without regard for status, citizenship, where they were born, even nationality. I saw a video of a Native American woman being dragged away saying, I'm a Native American, like her people were here before these ICE agents people were here, come on. And so when that natural friction that exists, that we always just kind of have a balance, and we work together with law enforcement, because they're also there to sometimes protect us, right? Violence against healthcare workers is real, and people listening to this who are healthcare workers know that, particularly in the ER. But they have this lawless entity like ICE, out there, with their guns, even if they're in their holsters, in their camo, with their masks on, intimidating, naturally intimidating, making staff nervous to be there taking care of people. I think it's antithetical to how we approach taking care of patients. And so as it puts up a barrier for that, I think this is, this is something that we need to stay on. And I know you're interviewing the doctor from Minneapolis to talk about this, from on the ground, what are people actually feeling and seeing, and scary stuff. I don't know. What do you think?
Yeah, this is reporting from the New York Times. So Over his 20 years as an emergency medicine physician, Dr. Robert Lefevre said he had encountered law enforcement officers coming in with shooting victims and other patients. But his quote is, "But federal agents barging into patient care areas, trying to question or detain patients. I've never seen anything like that," the doctor said. He works for the Regents Hospital, a few blocks from the state capitol at St. Paul. Have you ever been to Minneapolis, St. Paul? Like, the main areas of the Twin Cities are like bucolic, and like it's really hard. I haven't been there since this all started, but it's really hard to kind of imagine the capital area in St. Paul falling into, having soldiers essentially like, kind of misdressed soldiers. They're like jungle fatigues for like an Arctic environment in the St. Paul,
Arctic like urban environment, and I'm wearing my camo.
I mean, it's just they look like they just like weird thumbs sticking out. It's hard to like envision how mad that must seem, just like absolute madness, especially in a hospital setting.
Yeah, I mean, that's true. And I appreciate that quote because bar none, I've never had law enforcement like come into rooms. I mean, they always had a deference for, I mean, they would be in there if someone's like coming from the jail and they're in the room. And if there's something sensitive, they'll leave. But they always deferred to us, "Okay, doc, what do you need? What can I do to help you out?" Never like the attempts to apprehend people. And again, the way these guys have done it just on the streets or door to door, it's indiscriminate at best, right? And so if they're barging into rooms, and who the hell are they grabbing? I think, I mean, it's a predictable outcome of what they've been doing up there all along.
Yeah. There's two more topics on the way that sort of ICE in the Twin Cities interacts with the health system. So first, there are increasingly reports, and when this was happening in Chicago, there were reports in Chicago as well, but there's increasing reports that in the Twin Cities, and I've even heard in Michigan and some other places, ICE detainees are not receiving proper medical care. We also got reports out of Louisiana on that too. So concerns are being raised that medical care for ICE detainees housed inside an Ohio jail aren't receiving medical care. Advocates say immigrants held at the Butler County Jail are being denied critical medications. Every week, Hillary Davis has been making a 2-hour drive to the Butler County Jail with medicine in her hand. She's bringing it to a family friend after he was picked up by ICE. Quote, "There were drones flying around the area to find them, and they came into a house and they were working in and just took them," said Davis. So they're using drones to like find folks too. If I haven't seen a video of that, but I've seen it reported now. He's diabetic and he wanted his medications and he still has not received those medications, said Davis. "We got his A1C down from high level to very low level, and now it's in jeopardy." Advocates say he's not alone. This is not the only reporting of this. It's just some of the most recent. So I just say it strikes me that like, obviously, like the United States has not long had sympathy for the health and well-being of its incarcerated population. That is not a thing that the United States cares about, as or at least as other countries. But like what we know is that a bunch of these people are not have not committed any crimes aside from immigration status, which is an administrative crime, not like a violent crime. And in some cases, we know that people are getting detained for extended periods of time who are citizens, including people where they knock on their door, drag them out of their house, and then detain them for many, many, many hours. So it's not like they were impeding an investigation. It's just untrained ICE officers making mistakes. And these folks we're getting reports out of these facilities. They're not letting people get the health treatment that they need. Be they citizens, be they not citizens, whoever they happen to be. Yeah.
Well, Kavanaugh told them they could profile people, right? So there was no standard. Yeah. Kavanaugh just said at SCOTUS, you can just pick them up, take them in if they look like someone who might be here illegally. Yeah. I mean, it's always been a challenge. I will tell you,
the Kavanaugh stop lets them the Kavanaugh stop lets them stop anyone for like accents. Well, they claim. It is not clear that that ruling says that, right? But the Kavanaugh stop has been interpreted by ICE and DHS that they can use accents, skin color, all these like racial profiling, that they can do this to detain people. Then they have to have some reason to bring them in, and it seems like. So I would say that the bringing of people in who are citizens the hassling of that older Asian man, that older Hmong man in Minneapolis, where they dragged him out in his underwear and then they brought him to detention for hours on end, even though he was clearly a citizen. They proved it in real time. That is not necessarily like a affectation. That's not like an outcome of the Kavanaugh stops. The Kavanaugh stops are terrible. And then they're doing this additional thing where they're detaining people where it seems like there is no legal nothing that they're basing that on. It's just untrained guys hassling and detaining the corpus of citizens. Anyway, back to you.
Yeah. Well, I could just say, like, our local jail where I've worked for 20 some odd years, like the medical staff there are really good people. Like, people that used to work in the ER were techs and nurses in the ER. Now we run the nursing program there. And there's certain things they can and can't do. You know, give meds twice a day, not 3 or 4 times a day. So you have to alter all that. But they're genuinely looking out for people in some way, right? The system itself may not be that concerned, but they do have like actual healthcare staff assigned there who kind of come to work every day wanting to actually like do good and take care of folks. This just sounds like they're just like, fuck it. Well, who cares, right? And someone, you know, they talked about the A1C on a diabetic. That's just their chronic blood sugar levels. And if they're there for a very long time, right, that has real consequences for those folks in real time, but also kind of down the line.
Down the road, yeah.
You know, so yeah, I think it's something that isn't talked about enough, but is obviously affecting folks.
This one I'm going to highlight for anyone who works in a health system or a health contractor. So ICE has reportedly stopped paying healthcare providers. This is via Jed Legume at Popular Information. Under the law, ICE is required to provide necessary medical care for its population, which we know it is in some instances not doing adequately. But while ICE employs some of its own medical staff, it often uses third-party providers. ICE's Buffalo Federal Detention Facility, for example, houses over 500 detainees and has no doctor, dentist, or health staff. ICE, however, has not paid any third-party providers for medical care for detainees since October 3rd, 2025. Last week, ICE posted a notice on an obscure government website announcing that it will not begin processing such claims until at least April 30th, 2026. Until then, medical providers are instructed to hold all claims submissions. ICE's failure to pay its bills for months has caused some medical providers to deny services to ICE detainees. In other cases, detainees have allegedly been denied essential medical care by ICE. So in the places where they're not staffed, they're using contractors. And this is a good heads up for contractors. Not the medical contractors. Medical contractors, you should help those folks. But any other contractors, ICE is going to stiff you. ICE is going to stiff you like Donald Trump stiffs a contractor. It's in the DNA of the government at this point.
Sure. Yeah. Well, I mean, they have $50,000 sign-up bonuses for these goons, right? But they can't pay their bills. Like, you know where their priorities are, right? You know where their priorities are, for sure.
Yep, that's right. All right. More in the back half of the show on Minneapolis. So next up, Dr. Oz gave a wild interview, or quote around health services in Alabama. He thought that no OBGYNs in many of the rural counties in Alabama was, quote, pretty cool. Can we throw to that clip?
Alabama has no OBGYNs in many of their counties. So they're doing something pretty cool. They're actually having robots do ultrasounds on these pregnant moms. So we can actually get those images back to the big center. So we know if the child has a problem, and we know if that mother's at risk. We have one of the highest maternal mortality rates in the world, in the country with the best medicine in the world.
Wow. Dr. Crudite.
Dr. Crudite, man, the out of touch oozes out of him, right? Like he was God. I know the Crudite was just a funny thing, but the guy is out of touch.
It's him.
Yeah.
It's who he is.
Yeah, it's just who he is. Yeah.
It's all of them.
Right.
No concept of people not having health care and these deserts. I mean, yeah.
Yeah. And Rob, why does Alabama have maternity deserts?
Yeah, I mean, there's reporting, right, that since the abortion bans, or since Dobbs, right, and the near total abortion ban in Alabama, but in states with abortion bans, right, I think OBGYNs number down 4%, versus being slightly up in other states. If you look at applications to medical schools and residencies in states with abortion bans or near total abortion bans, we see a decrease. I think reporting showed about a 6% decrease in those places. So, and then Alabama is one of, is it 10 states now that hasn't expanded Medicaid, right? And having less Medicaid, I think if you look at like solutions to the OBGYN deserts, one of them is expanding Medicaid. Well, no shit, right? These are places where a lot of people would qualify for Medicaid. A lot of facilities would benefit. These are places that are going to get completely screwed by the big beautiful bill, $1 trillion Medicaid cuts to pay for tax cuts for billionaires. And Dr. fucking Crudité thinks pretty cool. That's pretty cool because it's a robot. Like you can see Trump is just sitting there going, Trump's probably nodding off and that's, ooh, robots. What's this about robots?
Bro, we're Jesus. A bunch of guys sitting up at a podium getting all geeked about how robots are doing ultrasounds in rural Alabama. I'd like to talk to someone who wanted a real OBGYN and got a robot instead and see what they think.
I mean, you just went through all this, right? We've reported you got a new little one at home. You guys went through all this for 9 months. Can you imagine if your interaction was, hey, here's your robot and we'll see you next month.
It was nice to ask a kind, smart human questions that they could answer. That was like a nice feature of the process of going through accompanying my partner through the process of being pregnant in a place that had real medical care. Anyway, that's too bad. I feel for the folks in Alabama. And Dr. Crudité is it's not cool. It's not cool.
Not cool.
It's not cool. I think, and I just want to say this as a person who overwhelmingly thinks robots are cool.
We're pro-robot.
In this instance, I'm pro-robot. This instance of robot, we could use a real OBGYN in Alabama as opposed to the robots. Yeah. Okay. In other wild quotes coming out of the administration, we got a real doozy from Robert Kennedy, if we can throw to that.
The interesting thing about the president is that he eats really bad food, which is McDonald's, and then, candy and Diet Coke. But he drinks the Diet Coke all times. He has the constitution of a deity.
Wow. He is I don't know if it cut off there, but he has the constitution of a deity.
Wow,
what?
Which deity? This made me really think. Right? Are they talking Big G God? Are we talking like Diogenes? Is that it? The Greek god of like drinking wine? No, Trump doesn't drink wine, but he was kind of sort of excess. Is it the god of war? Well, he said he's not so into peace anymore because they didn't give him the peace prize. FIFA gave him the peace prize. Thinking,
I wanted to see if there was a Catholic saint that was like the patron saint of cheating at golf, or if
the patron saint of cheating at golf. Oh God.
Yeah, or if there was like a Hindu deity that was really into like gauche gold decorations. I didn't find any, but I think it's unclear what deity is. But Bobby's point is, I think, another great example of like how much ongoing sucking up the heads of these departments have to do in order to get away with their insane pet projects. Bobby's being vaccines, destroying NIH and the CDC, some of probably the most destructive stuff that's happened so far out of the Trump administration. And the payment for that is to go on these organs of the Maha movement, in this case, Katie Miller's show, and suck up to the head guy, the chief. Right. And so he could sort of justify his movement. He can justify the incongruence between the Maha movement's interest in like whole foods and clean eating and the president's absolutely disgusting personal behavior and habits. And he can kind of he can justify those by making this extraordinary claim that he has the constitution of a deity. So I guess he was in a little bit of a trick box if he wanted to stay consistent. He's got to get there somehow.
Yeah, you're out there promoting healthy foods and saying, well, this isn't for all of you because this guy's a god, you're not. So he can
special.
do it. What I wouldn't give to see like the signal chat between folks and this little crowd, like, hey, take a look at that Katie Miller, show. Like, he called you a god, I mean, it's crazy.
Totally.
It's
right,
crazy.
and then you get someone to give it to him. And I wonder if there's like strategy. There's got to be somewhere, and if hopefully some documents come out or something. But there's got to be strategizing on how to suck up to him. It's because it's so consistently pathetic over such a long period of time that there's you're not just doing it by yourself. You're like working as a team to suck up to a guy who is increasingly volatile, whose brain is like breaking in front of us on a national stage. Right. He's like getting older and melting down. But you don't always have access to them. So they're probably like coordinating how to get their flattery to him in order to retain their positions of power, and probably time that flattery with the announcements of weird things like changing the vaccine schedule, for example. Right. I mean, the dance that's happening inside that inner circle is so yucky.
Yeah, I mean, it would be sad if it wasn't so disgusting, right? To see someone who, previously, again, a respected environmental lawyer that like was actually out there trying to protect the planet, right? Like Bobby Kennedy, bend over backwards for this guy. And like we said earlier, Senator Dr. Bill Cassidy, who at one point presumably was a physician who actually like cared about humans and under his care, and now has twisted himself in a pretzel to kind of appease this guy and finding out again. So I think Bobby probably sees that. They all see it, right? If you step out of line just a little bit, right? If you don't suck up enough, he's gonna stab you in the back. And so they have to keep the fluffing going.
Yeah. One on a serious note, on like, there's the Bobby's always thinking like almost everything Bobby does shouldn't be taken at face value for what he's saying. I think maybe somewhere he's convinces himself of some of these strange things and he believes strange things, but as a practical matter, he's almost always doing either principal managing up to Trump, or he's doing coalition management, managing down to Maha and the other interests and the corporate interests that he's interested in. And there was some great reporting by Politico this week on how Bobby Kennedy is trying to take some of the more unsavory elements of the trial attorneys. I find the trial attorneys, this is probably where I have a disagreement with doctors. I think some trial attorneys are pretty good, pretty good actors out there, but there's certainly unsavory elements inside the trial attorneys. And he's taking some of the trial attorneys and he's trying to marry them as a political force, and basically like some larger law firms who are suing pharma are basically saying that he is taking the government in a more pro-plaintiff direction, and that there are some folks who are interested in sort of either class actions on some of these fringy ideas around vaccines, or other ways that Bobby would sort of, I don't know if he's drawing from his time as a environmental lawyer, but kind of opening up the gates for the for less scrupulous trial attorneys to go after some of the pharmaceutical companies and others, not on the things that they should go after them on, like not on ghoulish profiteering, but on like fringy medicine items.
Yeah. I mean, he profited, right? He profited hugely off of, I think, lawsuits about Gardasil, right? That, HPV vaccine that prevents cancer, and so he is certainly in line with the unscrupulous parts of that crowd, and no doubt as part of coalition management would welcome some of those folks into the Maha movement, as it were.
Yeah. Kennedy, actually, I was just checking this out. Kennedy won cases against Monsanto in 2018 for the health harms allegedly caused by herbicide Roundup. He won against DuPont for contamination in 2007.
But now they're promoting big agro beef as the top of the food pyramid, right? Along with whole milk. Like, Jesus Christ, talk about
that. It's all that, and that
degrees.
is, that's example number one, that the most things that Kennedy's up to is coalition management. That we're putting beef and saturated fats at the top of the food pyramid, and we're shaping the way the federal government disperses funds to agribusiness in a way that, you know, that those business interests are very much a big part of the public communications, and that managing that coalition is like actually what they're up to, not the health and well-being of your children.
Yeah, for sure.
Yep, totally. All right, Rob, is it time to talk to Dr. Erin Stevens?
Yeah, looking forward to this.
Okay, great. Well, let's throw to that now. Coming up next, our interview with Dr. Erin Stevens from the Twin Cities. All right, everyone, we're back. Today, we are joined by Dr. Erin Stevens. Dr. Erin Stevens is an OBGYN physician in the Twin Cities Metro of Minnesota. She is highly involved in legislative advocacy and patient education through writing, speaking, and action. She has published a book titled Unexpected, a Postpartum Survival Guide, an honest, humorous, helpful preparation manual for new parents approaching the time after pregnancy. Dr. Erin Stevens, thank you so much for joining us today on Paging America.
Yeah, thank you so much for having me. I'm happy to be involved in conversations and letting people know what's happening here and how to help.
Yeah, I mean, I think like the thirst for a better understanding and clarity and understanding of what's happening in the Twin Cities, in Minneapolis and in St. Paul, we just can't. I think people can't get enough of it because it seems so hard to believe, and that we're almost. I don't know if we're almost searching for corroborating evidence, you know,
Right.
like and people who have sort of firsthand or even secondhand understanding of what's going on there. So maybe we can just dive right into it to help our listeners understand the way ICE is interacting with the health system in the Twin Cities. So so you're sort of in ground zero, being in the metro area. We're hearing reports of ICE and Border Patrol agents menacing hospital patients and staff, interfering with the delivery of healthcare in general. What has your experience been?
Yeah, so definitely have some firsthand experience, and then also just broadly hearing from so many people. We're all having conversations offline. I'm part of so many new text message threads and email chains than I ever was before. People just trying to watch out for one another, which I think is huge. But we all have seen ICE agents outside of our hospitals. Many hospitals have reports of ICE agents kind of patrolling the hospital parking garages, the first point of contact where patients are going to come.
Yeah.
At one point, I believe they were ICE agents, at least saw them outside of our hospital ambulance bay, kind of where a patient pickup drop-off zone is supposed to be, just kind of stationed there, going in and out of the hospital. Definitely, we've heard reports of ICE agents accompanying patients in to emergency room facilities. The specifics of all of that is a little sketchy, because I think a lot of people with the firsthand stories are afraid of sharing too much because they don't
Sure.
want to put their health systems in jeopardy or patients in jeopardy.
Sure.
But at least if a patient's in custody, technically ICE can come into those patient areas, which is a little iffy. They're not like normal law enforcement, and then having that potential exposure and access to other patients is really concerning. We had a patient who was at one of our hospitals in the metro who was shackled to their bed and had ICE agents at bedside for quite a long time. There have been ICE agents who have refused to leave the room when patients have sensitive exams or like have a bath, things like that, like really sensitive things that those agents shouldn't be there for, regardless of what the situation is.
And so maybe just to ask a couple of questions about. So in the instances where you've seen ICE agents or you've had close colleagues witness ICE agents, are they as armed and like some of the images that I've seen is like they are either in fatigues or full battle rattle, and in some cases like very armed. And is that when they're sort of crossing the threshold from, you know, out in the street into the medical setting, is that the case?
Yeah. And of course, you know, we can have lots of rules and guidelines and protocols of where they can go. But when there's this kind of aggressive appearing, intimidating presence, you know, what do you do in that situation, either as a patient or as a healthcare provider?
Yeah. So we've we've heard about, or at least sort of through the grapevine, there's just like, there's also like, there's a bit of like fog of war on all of this stuff because one, sometimes they're not clearly identifying themselves as ICE agents, but two, I know there's also a bit of fear seeping in. But are you seeing instances of people avoiding getting healthcare out of fear of being, for lack of a better term, abducted by the federal government?
Yeah.
Have stories of people avoiding care and not receiving needed care come up?
Yeah, absolutely. And that's our biggest concern right now. And constantly in all these conversations I am a part of, I see, hey, there's this patient who needs access to mental health care, who can come to their home or do a telehealth visit. This person is considering a home birth and they never considered that before. What can they do? There are people looking for resources, and there are people on the ground kind of minute by minute trying to figure out, well, how can we rearrange our systems and meet these people where they need us so we can safely provide healthcare? And it's really difficult because I think some people in the healthcare setting, we're all kind of rule followers, and we think, well, everyone else follows the rules too. And ICE has these particular protocols, and they're only supposed to be in XYZ area. And that's lovely to think that that's what's happening. But even if it was, patients have to get to the hospital in the first place. They have to leave their homes, and ICE is patrolling the streets in some areas. They're on the roadways. They're pulling people over based on profiling. And so if you can't even get to that place of care, you can't get the healthcare that you need.
Absolutely. Dr. Stevens, it's so funny that you bring up that healthcare folks are rule followers. As a longtime union organizer who now works with doctors across the country, that couldn't be more true across the board. But have you, sort of in that vein, have you seen instances of folks being sort of, whether it's physicians or nurses and providers, or fingers crossed, I bet not, but maybe like hospital systems or executives. Have we seen any sort of bravery and courage on that end in the face of what is like obviously an unprecedented situation?
Yeah, I think we're all trying to do our best, right? And even as I've just walked through the emergency room when I've been on shift, it seems like every time I go through there's like some sort of huddle of, here's what we do if ICE arrives, and there's emails going out every day, human resources contacting people, here's what to do, here's the chain of command, and we all kind of have the script of what we need to say and what we need to do. I've heard reports of hospital volunteers standing up and trying to intervene or record, and kind of being pushed away as well. So I think Minnesotans help each other out, and we're definitely stepping out to try to protect everyone. But again, it's hard with such a large presence of agents, and they are intimidating. And as a federal agent, what are you going to do if they tell you no, right?
Yeah. Maybe moving beyond sort of the bedside or the ED into public advocacy. We've seen incredible images of all types of people fighting back in their own way, or educating the public, or telling the story out of Minneapolis and St. Paul and the greater metro area. But there was a pretty special press conference, I believe yesterday, of physicians coming together to tell their side of the story and how disruptive this is for healthcare. Could you tell us a little bit about how that came together and who's involved?
Yeah, so I'm someone who I really believe in the power of words. So I do a lot of writing and speaking, write op-eds and testify and make little TikToks about what's important and what's going on out there. And so as I saw all this happening and saw a lot of physicians trying to do good work and trying to connect, which is really hard right now because everyone's kind of working in secret and trying to make sure that they're not making a lot of noise so they don't draw the wrong attention. I started first just trying to organize physicians. How can we better communicate? How can we get people connected on specific issues so that they can work more effectively and efficiently? And then I do a lot of legislative advocacy. So I reached out to countless lawmakers for our state and said, is there anyone who would like to partner with physicians? I don't know for what yet, if it's a statement, a press conference, what we're going to do, but let's work together. And luckily, our two physician state senators responded to me, Senators Drs. Mann and Klein. They're both wonderful and have been really great allies in the past. And their staff helped us kind of throw this together. And of course, we're limited in time and who can speak. And we really envisioned having so many wonderful speakers and had to kind of pare it down to certain subject areas. And I thought it was really important to try to get us to speak on behalf of medical organizations, because I think that's very powerful to say this entire organization of physicians is concerned about this and is standing in solidarity. And you probably know it can be really hard to get a medical organization to write a specific statement on a topic or endorse one, because there's lots of layers of nuance and bureaucracy and politics within organizations. So to be able to come out and say, as the Minnesota section of the American College of OBGYNs and American College of Emergency Physicians, all these different organizations, here's what we say and here's what we believe and here's what we're saying, that is a lot more powerful than I think the general public realizes. And Senator Mann was the last one to speak at our conference yesterday, and she made this really great point. It's really, you don't see it a lot, to have doctors from all specialties all across the state in the middle of the day on a Tuesday come together and stand there together. So the showing that we had, I thought that was the most impactful thing, that we had all these people that were able to come together and say, we stand with these words, we stand with these statements. So I was so happy that it worked out, and I hope it has an impact on people, that they say, well, here's what's actually happening. You can talk again a lot about what would happen in a perfect world.
It's hard to, I think when you have a phalanx of accomplished people wearing their white coats, speaking from a medical perspective, it's kind of hard to call them Antifa.
Who knows though, right?
Watch out. Yeah, absolutely. I think that's great. And, on this show, we are extremely critical of some of the legacy medical societies around the country and their inability to get their shit together to be proactive communicators. So, but like, credit where credit is due to the people who came together and are standing up for patients in Minnesota, all the Minnesota factions and chapters that participated in that. Kudos, credit where credit's due. Yeah.
Yeah. And, there's lots of nurses doing this work too, and other healthcare professionals. And I don't want to discount that at all. And I wish we could have had all those people speak too, but I think healthcare workers in general are really standing together and really trying to fight for our patients right now.
Well, yeah. Well, it's unfortunately, I think this is probably not the end of ICE activities anytime soon in the Twin Cities. So I think there'll probably be plenty of opportunities for people to speak up and speak out and tell their side of the story. Before we go, so it seems like Trump might be planning to escalate ICE's presence around the country. Particularly in blue cities, my city of Chicago, could be Philly, could be Detroit. Who knows where they're going to go next? They have said they are going to come back to Chicago, but medical professionals across the country have to get ready for this, particularly those that are in large systems and in major metropolitan areas. What advice would you have for a lot of advocates listen, but a lot of healthcare providers listen to this podcast? What advice would you have for healthcare providers, clinicians of all stripes, who might see sort of what's happening in Minneapolis and St. Paul come to a neighborhood near them in the future?
Yeah, I think organizing sooner rather than later, figuring out who are your friends, who are your allies. A lot of what I'm seeing right now is people trying to figure out, how do we increase capacity for home care, home visits, and that's something that's hard to do on the fly and suddenly organize. So having a system to make that happen if you need it to, who are your actual friends within your organization, and your health systems having protocols. Here's exactly what we do if an ICE agent shows up. Here's how we handle it. It's better to know that in advance and prepare in advance than try to keep up with emails every day of what's going on and what activity we're seeing. So just being prepared that it is going to happen and that you're going to have to figure out how to deliver healthcare in a totally new setting. I mean, a lot of people keep comparing this to COVID because it's like, this is an unprecedented thing we've never seen before, and suddenly we have to make the health system adapt to that. So how do we do that? How do we get patients prescriptions in their homes and deliver groceries and get them diapers and make sure that they're seen for their health care? And then if they do need to go to a hospital, how do we get them there safely? All of that is everyone really organizing underground to make that happen. I've been so impressed by seeing everything everyone is doing, but it shouldn't have to be last minute. Let's try to make this happen. You should be prepared in advance.
Yep. Don't wait. All right. That's incredible that it's sort of being compared to the once in a generation global pandemic that the health system is going to have to react in such a way as to confront that. Completely elective and unnecessary, by the way.
Right.
So unlike
our
the
entire
pandemic.
lives have just been once in a generation things happening over and over again. Right. So we're ready.
Well, Dr. Erin Stevens, thank you so much for joining us today and pulling back the curtain a little bit so people can understand what how people providing care in Minnesota are confronting this incredible situation, this incredibly tragic situation that's happening in the Great Lakes state.
Yeah.
I think we'll leave it at that. Dr. Stevens, thank you so much for joining us.
Yeah, thank you so much for having me. I can't wait for others to hear this message.
Okay, we're back. Dr. Rob, from Down Under, from tomorrow.
Yeah.
Anything you want to share with the audience before we go?
I tell you what, the immediate future is bleak, but boy, hopefully we're all a part of the distant future being a brighter day. So I'll leave you with that.
Okay, that's helpful. Maybe before we wrap, Dr. Rob, if you are you going to go see the Hobbit's house?
Oh yeah. Hobbiton is about an hour and a half.
Are you going to go to
here.
Hobbiton?
Oh yeah, for sure.
Okay,
that's cool stuff.
A little bit of a high school Lord of the Rings nerd myself, and if I had a chance to go see Hobbiton, I mean, I read the books in high school. I enjoyed the books in high school. I haven't read The Hobbit since like 10th grade. Haven't read the trilogy since 12th grade in high school. But if I were in New Zealand, I would absolutely go see the Hobbit house, and I would really enjoy it. So I hope if you
very cool, and we get to go have a drink at the Green Dragon. That'll bring back memories.
Excellent. Send a picture.
Yeah, we'll do.
Yeah, great.
All right.
Okay, Dr. Rob, thanks so much for chatting today from far away. And today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dillon Schneider, Joel Bryson, and Chris Savage. It was edited by Darian Badigan. Our music is by Annette Somerset at Dune Flower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast. You can also follow Paging America on Substack. And if you want to help support all the things that we're doing here, please become a paying subscriber. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. Catch you next time, Dr. Rob.
See you then.